Thanks, Dr. Nitin, both for setting the base as well as calling me here for this wonderful IC. And it's really interesting to see that all the seats are occupied, Dr. Sandeep. So uh, it is a dilemma when a 45-year-old comes to you for for getting rid of glasses. And they are demanding people. They are in some prime of their age and they are used to having their ways. So they are going to demand perfection. They are going to demand no complications and safety, because also they are in the primes of their lives. They are the earning members. They want to play it safe. So for me, if there is a clear lens, I don't want to touch it, because you don't know when the cataract would develop. For my own mother-in-law, I treated her cataract at 82 years of age. So she didn't need a cataract surgery till that long. So why unnecessarily remove a functional lens if there is a choice? If you ask me, I'm definitely above 40, I hate to admit it. I still don't need to wear glasses. I have 6/4 vision in each eye. And I can still read all my WhatsApps. You can check my phone. So some of the lenses do remain functional. They do provide accommodation. So not all lenses should be punished for no crime of their own. And just to give you that satisfaction that you had given some correction. So with that basis, I would like to just counter argue whatever Nitin has said. So the features of a 45-year-old typically is that they have difficulty for near work, and that is just commenced. So they're still grappling with the fact that they have aged. On top of that, if you're going to add this insult of telling them that you would need a lens exchange, it's similar to a cataract surgery, but without a cataract, it is going to make them feel scared. Most people would take a step back and say, what are you saying? Do I need a cataract surgery? And that's something that's going to be in their decision making also. They still have some accommodation left. They generally have not significant lens sclerosis at 45, and they may require surgery any time after 15, 35 years also, as I said. And there are benefits of refractive surgery. It is an extraocular procedure. Whatever you say, even an uneventful cataract surgery can lead to sometimes CMEs. It can lead to a PC rent for no reason, just the patient moving slightly on the table, and you could end up in a grave complication. And if a person can't tolerate the press beyond, where there is a micromonovision with increased depth of focus, then it is difficult for them to neurally adapt also to these multifocalities and trifocals and extended depth of focus lenses, because it means that their neural system is not just ready for any compromises, and then they are better off wearing glasses and not do anything of this sort. So what is important is that the refractive surgery can give you a remarkable accuracy, because you are going on the cornea, and you would find that if you compare LASIK results to today's modern day higher order premium lenses, you would find that LASIK results are much safer, especially with the advent of femtolasers. You have special parameters where you can cause a Q wave change, so Q value change, which means that you can increase the depth of focus by making the cornea hyperpolate. And most of the laser platforms are not giving you that option. And you can also take care of the corneal wavefront aberrations to achieve a higher quality of vision. So today, the contrast sensitivity and the quality of vision is sometimes even better than what you can get with your glasses or contact lenses. There is possibility of enhancement, and it's not very difficult because you already have a nice femtoflap there. And there is no interference with the later cataract surgery. In fact, you can also get away with a monofocal lens if you've done a press beyond like surgery, you have induced hyperprolicity on the cornea. So later on, when you actually need to do cataract surgery, just a monofocal lens will also give that added advantage of depth of focus. So you won't need to compromise on your quality of vision even then. So it definitely becomes a much more lucrative option. The disadvantage of prelex is that patient instantly loses natural accommodation. So if you have to put in a monofocal lens, it has to be like really a monofocality, where you have to induce, so the dominant eye kept absolutely metropic, the non-dominant eye would require to be at least 1.5 to 2 diopters. Some patients with multifocal lenses are unhappy with glare, halos, loss of contrast sensitivity, and they need not be as perfect a result as refractive results. And the risk factor is higher than extraocular surgery. And I would say that I have an example where I treated my own husband. He was 6/4 each eye. He was becoming presbyopic. I treated him at 46 years of age, exactly the same scenario. We did press beyond. It's been 14 years now since he has undergone press beyond, and he's still without glasses. And people who know my husband knows he's an avid reader. He is into stock market, so he's on the computers all the time. And he loves to drive, so we have also taken driving trips to Himalayas from Vadodara. And he is not needed to wear glasses. We did need to do one enhancement 5 years back, but he's still without glasses, so I rest my case.